And the female pelvis is different than the male pelvis in that the male pelvis is longer, right? And it's thinner. And so the female pelvis is shorter and more squat and wider so that we can give birth to children. And the front of the pelvis is the pubic bone, and it's separated by a ligament. And as you might recall from the 200-hour teacher training, pregnant women have a special pregnancy hormone called relaxin in their system that relaxes the connective tissue, including the ligaments. And that allows for more laxity in the pelvis. And so think about, as yoga teachers, we're always trying to create stability in the pelvis. But here is a time in a woman's life where that laxity is helpful for her so that her pelvis will open during the birth. But that relaxin is softening up that connective tissue, particularly in the last trimester of her pregnancy. So the pubic bone can spread during the actual birth. In the back, you have the sacrum and the coccyx or the tailbone, and then you have the ilium or the hip bones. And so you have two sacroiliac joints. And the way that the sacrum and the ilium fit together are kind of like a piece of china that's been broken and then placed together just so. So the sacrum fits right into the ilium, and then that's all supported by ligaments that hold and stabilize that joint together. Now, this is a joint that can become very unstable, particularly in women during a yoga practice. And the reason for that, especially during the seated yoga practice, is that the ilium is holding this wedged in sacrum, right? And when you're standing up, it wedges in quite tightly. So standing postures are going to provide more stability for the sacroiliac joint. The seated postures, once you sit down, the hip bones open up and the sacrum is much less stable. Now, when you add in forward bending and hip opening postures, that you can really rotate the ilium off of the sacrum in a way that creates laxity back there and can create instability and sometimes injury. Does anyone have a sacroiliac joint injury in the room? Right? 1, 2. Okay, so, and I'm 3. So that's fairly typical. So in a room of about this many people, you usually, and especially in a teacher training where you have practitioners that have been practicing for some period of time, right? It's not like a workshop, it's teachers who have been practicing yoga. So in a room filled with yoga teachers who have a considerable amount of experience of practicing yoga, you're going to see a handful of sacroiliac joint injuries. And so why? Like what, why does that happen? And it's complicated. But one of the major reasons is because of excessive forward bending and hip opening and twisting, torquing the sacrum, right? And overstretching the ligaments that are supporting the sacrum, causing it to become hypermobile, right? And so why does that happen? Well, think about if I were to sit in a seated twist like this, and let's say that my pelvis, that I had a male pelvis that was longer, right, and more compact, where my sacrum wedged into the ilium more tightly and was more stable, then when I bring my leg across, it's not going to be as likely to torque into my sacrum. But I have, and especially a woman who's had several children, I've had 3 children. So a woman who has a wider pelvis, right, and a squatter pelvis, now she sits down, which automatically makes the sacrum a little bit less stable. And now I am going to take my foot across those wider hips that are already opening, right? And it's very easy to turn the sacrum in the ilium, within the pelvis. And that can cause that instability or that laxity in the sacroiliac joint. Now, why does this need to happen during pregnancy? Because during pregnancy, we need that to all open up in order for a baby to get through. So this is what happens. The ligaments that support the sacrum in the front and in the back are also getting lax. And that's going to enable the ilium to pull away from the sacrum to create space. So if The ileum are widening from side to side at the pubic bone and at the sacroiliac joints. That's going to widen the space between the sit bones. Does that make sense? So that the pelvis gets wider for her to be able to give birth to a baby. But the baby has to move through all the entire pelvic outlet, which is the sit bones on either side, but also the pubic bone and the sacrum and the tailbone. So in addition to the pelvis getting wider from side to side of the sit bones, the sacrum and the tailbone are going to move away from the pubic bone. Okay, so the sacrum is going to lift, not this much, thank goodness, but I'm exaggerating to make a point. But so the sacrum is going to lift up to create more space between the tail and the pubic bone. So that's going to enable the pelvic outlet to widen from pubic bone to the lower sacrum and tailbone, and from side to side, sit bone to sit bone. And you know, in yoga, we often say bring your pubis to your tailbone to your pubis, right? But in birth, you want the exact opposite. You want the tailbone to move away from the pubic bone to create more space for that baby to be born. Well, that's happening throughout the pregnancy. It's not just happening during the birth experience. So even if a woman has a cesarean birth, her pelvis is still going to end up wider after she has her baby, even if she didn't have a vaginal birth, right? If she does have a vaginal birth, it's going to widen even more because the baby is going to open up the pelvis as she gives birth to the baby. So this is how the baby moves through. The baby's head is widest from front to back. It's longest from front to back, and it's more narrow from side to side. So this baby is going to be in a fetal position, right, like this, okay? And the heaviest part of the baby is the back of the baby's head and the baby's spine, all right? Yeah, if you need to move, feel free to move. So here's the pelvis, okay? And this baby is going to, okay, now babies are not born like Jesus Christ. This baby is going to be in a fetal position, so just imagine that, all right? And the pelvic inlet, which is right here, see that, right? That is wider from side to side than front to back. So the widest part of the baby's head is going to align itself with the widest part of the pelvic inlet, yeah? Then, the widest part of the pelvic outlet is pubic bone to tailbone, not sit bone to sit bone. So now the baby has to turn, okay, so that its head aligns with the widest part of the pelvic outlet. And then, it's going to be born like that, face down. Now the shoulders are obviously wider from side to side, and we've just established that the pelvic outlet is widest from front to back. So the baby has to turn yet again to be able to get the shoulders out, right? And that's how babies are born. So in order for that to happen, we need to have space. We need to have space between sit bones and between the tailbone and the pubic bone. Also, the way that the baby is positioned makes a tremendous difference. So if the baby is malpositioned and the baby turns the wrong way, right? The baby turns this way, it's going to be, or there's many different variations on a malposition, it's going to present larger. The head is going to present larger and make it a lot more tricky for that baby to get out, right? So essentially, we have to, you know, so what does this have to do with yoga? Essentially, what we're trying to do when we are teaching pregnant women is we want this process to happen. So if she feels a little, you know, if she feels some discomfort in her sacroiliac joint, whereas if she weren't pregnant, we might think, aha, it might be an injury, or it might be the potential for an injury. But when she's pregnant, it's just, you know, something that happens during pregnancy, but we don't want it to become injurious. So it's a little tricky to kind of deal with, because you want to stretch all of the muscles that surround the pelvis so that this whole process can unfold. You don't want all of the muscles to be super tight and holding the pelvis together like this, right? You want the muscles to be nice and flexible to allow for this whole process to unfold during her birth. But at the same time, you don't want to exacerbate the instability that's already happening because of the hormones and create a situation where those ligaments become permanently overstretched. Because permanently overstretched ligaments is a very long-term injury. Usually it's chronic for the rest of her life, because overstretched ligaments don't just go back. They don't just heal like muscles do. They're not very vascular. And so if you have a sacrum, you know, I'll say my sacrum's out, right? It's not quite right. you know, it's one of those things that I'll deal with for the rest of my life, and I do, and it's nothing that is incapacitating, but it's definitely something that I need to watch when I'm practicing yoga, right? And a lot of women have the same situation. And even if you're dealing with women who are not pregnant, remember that this is all true to a lesser degree for them. So we need to make sure that we are not twerking or putting strain, creating instability of the sacrum for all practitioners, all female practitioners. Also for men, but men just aren't as much at risk for these injuries. You rarely see a man with sacroiliac joint dysfunction, right? You rarely see it. It's almost always women. Okay, any questions about that so far? Nope, okay. So one thing just to kind of end with, which is this, which is, so think about, in many hospitals, one of the number 1, number 2, or number 3 reason for C-section is the pelvis just wasn't too big. The pelvis was too small for the baby to be born. Well, you know, think about it. If you have a woman that has been laboring in bed on her back like this, right, for 8 hours, 10 hours, even less, and then she pushes in that same position for a couple of hours, right? She's basically putting all of her weight right on the sacrum. So if her knees pull into her armpits, right? And as yoga teachers, you know, if I pull my knee into my armpit, my sit bones are going to come together, right? So that's going to narrow the sit bones, right? And then if I lie on my back and I scoop my tailbone underneath me, kind of like when you pull your knees into your chest, right?